Young people with mental health conditions can soon receive care closer to home. A new initiative under the President's Challenge aims to equip social service agencies with skills to identify such youth and to care for them. The Supporting Youth in Community programme will reach out to at least 200 of them each year from next January. Chua Tian Tian reports.
This virtual exhibition is a labour of love by some 13 youths facing mental health challenges. It's part of a programme called Curiography, which aims to use photography to spur curiosity, thereby improving mental well-being. The 39 photographs on display draw on the personal experiences of the creators and provide a unique perspective of how they view the world. Now, this photographs, for instance, aims to put the message across that there's always light at the end of the tunnel, no matter how hard things can get.
In general, if you're going through a hard time in life, maybe you're so fixated on one part of your life that you can't seem to overcome. But going through photography allowed you to be able to take things from different perspectives.
So during the workshop, we bring the youth out for photo walks after sharing with them certain functions of the camera. I think that photography allows them to visualize the thoughts that they have in their minds.
At the exhibition's launch, President Halimah Yacob says more youths are now battling mental health issues. For one thing, the number of adolescents seen at the Institute of Mental Health for Depression have risen by about 60% from 2015 to 2020. But many others may not seek help due to the stigma involved. That's why a new pilot has been launched to equip social service agencies with tools to support youths between the age of 13 and 19.
In particular, we find that two groups of youth need more help from our current system. One, those whose needs are not severe enough to be admitted into IMH, but still require community support. And secondly, those who require care after discharge from IMH. The PC-IMH program will serve as an important bridge between hospitalization and home care for youth with mental health issues.
Training for social service agency or SSA staff will cover basics such as interview and assessment skills. It will also include areas such as anger management strategies.
The outreach will also be able to engage their family members or their schools or friends. So this is better because in view their circle of friends and their body image, their self-image and self-confidence. All these are areas multiple areas that we should be targeting.
4 social service agencies are on the pilot for a start. Training will take place from April, and the IMH will refer cases to the agencies from next year.
At the same time, a warning that more needs to be done to help young people suffering from mental stress as a result of the COVID-19 pandemic. Social and Family Development Minister Masagos Zulkifli says government support alone is not enough. He has been speaking in an interview on Channel 5's News Tonight.
It is not just about agencies coming together, which is what we are doing. For example, MSF and MOH and even MOE working together to come out with strategies for parents and families to help their youth to cope, but also how we can produce innovations, new initiatives, ground up from the youth themselves to provide peer support, for example. So there are many things we want to do, not just to institutionalize it or to medicalize it, but also to provide a whole spectrum of help according to the need that the youth may need to address their mental health issues.